Uh, I suppose that all of you are there, and am I audible to you? Can anybody message? All right. Thank you, Veera, for the message. And uh, I should not wait. Actually, it's already 2:10, and some of the queries that I received, I will answer those queries. You can message immediately. Also, if any queries that you want to ask additionally. Otherwise, first, welcome all to the live session, and I hope that you all are enjoying the toxicology course. Although this, you can understand, this toxicology is a very vast discipline and very basics. Although I have covered, and it needs to be more to be studied in that regarding toxicology. And regarding the few questions that I came through the different portals on this as well, that one question was that someone asked about the PDF of the whole lecture. So definitely it will be provided to you. So we are working on it. Translingua app is there, and with that help, the technical assistant team is working on the translating all the pronunciation and all those things. And it will be provided to you in the PDF format before the end of the whole course. So although it is a little delayed, but you will have to manage with that, and it will be definitely provided to you very soon. And second important question was that how to prepare for the exam, final exam. So for this, actually the 50% of the questions that you will be receiving in the final exam will be the questions that you will all were already asked in during your whole of this assignments, different exam assignments that you did during these 12 weeks of the time. From there only, the similar type of, or the maybe options may be arranged or rearranged. 50% of the questions will be same for those of the assignments that you completed during this 12 week of the course, and rest 50% will be you need not to be worried. They all will be from the this whole of this course only. None of the question is from outside of the course, and so I will suggest you to sincerely watch the videos, and if you get the PDF format, then you can revise them and revise the questions, that assignments that you are getting. So by that only you may be covering the whole, all of the questions, most of the questions in the exam. And in case you want to read additionally, you can read any toxicology books of the forensic medicine. There are a lot of toxicology books available. I have already given the references in the first slide of each lecture. You can see the reference books that you can read from that, and available PDF format of the books also available. Internet journals you may use. So it's a basically basic idea is not to just pass your exam, but you should try to understand the concept of the toxicology. So for exam purpose, this much is only required. Just you cover the course and you revise your assignments and all those things. That will be enough for your exams. And I am giving you advanced wishes for your exams. Best wishes for exam. Do well and get at least certification when you have completed your course. Then third one is that this was the general questions that were asked by you. Then another question that were asked during session and that I could not cover. One question was, can you define toxin, toxicants, and toxicosis? Someone wanted a clarification about these three concepts. So already it is covered in the topic in the first lecture, I think. And in that, the toxin is the any poison that is produced by the living organism. That may be the plants or the animals, like the botulinum toxin. Clostridium botulinum is a bacteria that produces botulinum toxin. Similarly, the snake venoms that is also the produced by the animal. Many mushroom plants and the various plants you had gone through. So all those things that are producing are the toxins, and the toxicants are the any poisonous substance that are produced by the non-living things, that like the all the chemical forms of the substance, like the pesticides, these pharmaceutical drugs, all these are toxicants. And the toxicosis is the clinical features or the the symptoms or the problems that are produced on the body of a human being by the poison, that can be toxins or the toxicants, they all will be covered as a toxicosis. So any disease condition due to either toxicants or toxins on the body is called as toxicosis. So this is a simple idea, although this is not this practically that all the things toxicon, toxins, poisons are used synonymously in the practice, and it doesn't matter in general much, but this is the true concept with respect to those. Then another question that was asked during session was the therapeutic index related clarification. Someone asked that in the lecture it has said that it is the comparison of the amount of drug that cause the toxicity to the that cause the therapeutic index. So in the slide it is the to comparison of the therapeutic index to the toxicity. So basically that definition is also correct, because it is comparison when basically therapeutic index is the comparison of the amount of the drug that will cause toxicity to the amount of the drug that will cause this therapeutic effect. So when you compare something, it is not that which one is above and which one is below. When you say that in the form of ratio, then only it is that will be correct, that it is the ratio between the ratio of the comparison between the amount of the drug that causes toxicity to the amount of the drug that causes the its therapeutic effect in the population. So when I am emphasizing it is a ratio, then it is important to say that toxicity is above and the its therapeutic effect is below. However, when I speak that it is a comparison between two, then it can be either way. It can, if you say the therapeutic effect earlier and the toxicity later, it hardly matters. So this basically is the confusion that I am clarifying. Then another question that had been asked was the tell us more about the inhalant poisons, how difficult it is to detect at the toxicology labs. So inhalant poisons is a very interesting topic to read, and when medical legal point of view, when you will come through the inhalant gaseous poisoning, then it is very difficult to tell which poison has been used and what type of inhalational gas has been used, and many times it is a very tough scenario. I will share many cases with you. One of the case was that this is you may say that in many countries this inhalant poisons are used as a method of suicide, very common method of suicide and even execution. Or you must be knowing about the euthanasia. So to euthanize this inhalant poisons are being used, and many of the poisons are that which causes the painless death in those persons. One of the case that I dealt personally was in the Delhi, when some very high profile person, he was of the around 15 years of age, and he had served in many good companies at a very high level, and he was means exhausted with the life and all those things, and he had written a well suicide note, and he had committed a planned suicide. In that, what he did was he purchased the gas cylinder, and in that he put the inert gases like the helium and the nitrogen, like those gases, and then he booked the hotel, and there he uh, used that mask bag and that suicide bag, you may say, and they have the exhaust pipe as well, and he committed suicide by inhaling those of the inert gases. Now you can see that now the police, when the suicide was committed and after his death, the police or the hotel room was opened, and all the investigating team reached there, and they found the person lying on the bed with the mask and the cylinder on the bedside, and the suicide note in his pocket and all those things. So it was basically a very clear-cut case of suicide, and the body, after the removal from the hotel, it was brought for the autopsy. And now you can see there, when it was brought for the autopsy, police already removed the mask and the cylinder. They were brought separately, and the body is there. You are only able to see that the effect of the asphyxiant gases, inhalant gases, symptoms, and the signs were there on the body. Apart from that, you will not be able to say anything else. The body is congested. You cannot very accurately say. Many times, even the disease condition, those scenarios could be there. So you can, by just gross examination, if you don't have a proper history, suppose in that case, if it was not given a proper history to the doctor who is performing the autopsy, he will not be able to tell exactly what was the reason for his death. In those cases, typically we will order for the toxicological analysis, and that will go to the toxicology lab. And in there, what will be there that in those cases, there in the toxicology lab, again you can see the gases that has been consumed are the inert gases, helium, and the nitrogen. So how these gases will be detected in the toxicology lab? They are the natural components of their, even they are present normally in the body. So even their quantification is not going to help. Many times those which are present naturally in the body, their quantification may help in the diagnosis of the poisoning. But here, even I quantify the gases, the collection of the gases, proper collection of the samples is very, very tough. That you should collect it properly. You should send the cylinder, even it is gas cylinder, so they will just tell that it is containing oxygen, nitrogen, or whatever gas. But inside the body, they will find nothing. Even after the opening the body, as I already discussed in the class, how to preserve sample in the inhalant gaseous poisoning. You have to cover with the liquid paraffin and all those things. And even after that, in the natural gases components, it is very tough to detect that this particular gas has been used as an inhalant poison. So here again, the many times the crime scene examination, circumstantial evidences become some more important. So these are the such scenarios where the just we cannot rely on the toxicological analysis, and in many times because this is important to know that most of the toxicological analyses that are done for the toxicological purpose, medical legal purpose, they are basically done on a limited number of poisons. They usually this particular sample doesn't contains the common poisonous substances. They basically apply the in the forensic science laboratory. They basically apply the limited number of the poisons test like the benzodiazepine group and all those pesticides group and all those. If you are suspecting some typical type of poison, then you have to specifically mention that this particular type of poison is suspected, and then in those cases they will apply the test for that poison, and then they will give you whether this is present or not. Otherwise, very limited number of poisons toxicological labs reports are given. So additionally, I want to add in that in that view, it is very essential, or you may say that toxicological labs need to be upgraded. That is an important lacuna in our country, that we don't have very much developed toxicological labs, and most of the toxicological labs are being used for the medical legal purposes, and they are attached with the forensic science laboratories, and there they are being done under the forensic chemistry, and they are only doing the test on the medical legal samples. So these are the limitations with respect to the toxicological analysis. And even the pharmaceutical drugs and all those things are not being tested routinely. So there are a lot of lacunas with respect to these forensic toxicology labs. So this is a one point that is concerned with the inhalant gas poisoning. So you can understand how difficult it is to detect the inhalant gases poisoning. Then another, I have seen, although this is from my side of answer, although you have very limited questions that you had asked. So if someone want to ask more questions, they may ask right now as well. I have seen in the course that many of the students from this MSc Toxicology, Forensic Toxicology group of the students have joined in the course. And for them, I want to suggest that this toxicology discipline, or I must say that toxicological labs is a very rising field, and they have very huge scope in that area. They're like you will be seeing that lal path that we are testing for the different body fluid and for their biochemical test and all those things. But there are very limited labs which are testing on the toxicology. And very recently and very frequently, I am being asked by the people that sir, I have this liquid or this drink, and can you tell that what all toxins are there and what all the substances are there? Like the water sample, some may bring, like the food sample may bring. Recently, some drugs, even in the forensic toxicology labs, those which are done being the on the medical legal purpose, they are not mostly using the pharmaceutical drugs even. So these pharmaceutical drugs testing, many recently news has been there that many of the government supplied tablets, they are just containing the starch and the this your this talcum powders. So like those of the things could be there. They want to test the effective test of the drugs. They may want to test the water sample. They must want to test the air samples. They may be interested in to test the food samples. They may be interested into the place some hotels and they want to get it tested for their quality. So this type of labs is not available, and definitely you may provide the paid service as well to the public as well. So this toxicology lab may be an emerging concept and maybe an idea that may be established, and here various samples may be tested, not just for the medical legal but for other purpose that may be associated with the hospitals as well. Right now, none of the hospitals have they have the biochemistry labs, but they don't have the toxicology labs. So there as well, they can test for the toxicological analysis, and there they have a very important role, and that may solve a lot of issues and even the health issues and many of the health issues that I already talked. Although I don't have much of time on that. Many of the organs that are involved, skin diseases and many renal diseases and all those, they are related with some form of the toxicity. So they all problems may be prevented by just changing the lifestyle or the daily intake. We may prevent the various diseases as well by knowing the what type of the toxicity in their food items and all those things. So these labs may be very playing a very important role in health perspective as well. So I will suggest to think about that and work in that direction. This is all with respect to my live session. I am not finding any more questions. If you have any additional question, you may ask. Uh, so you have any more questions remaining? You may directly message right now. Sir, one question is there. Sir, the PPT you showing the lecture where we can get as those are simple to understand and can focally watch the lectures without worrying to note and everything. I can, sir, you are audible. Sir, the PPT you showing in the lectures where we can get as those are simple to understand and can focally watch the lectures without worrying to note and everything. Uh, I could not get your Vira. Can you in the lectures where we can get the notes for that? Definitely, you will be shared the notes for that. You did not to worry about the notes. I already told. You will get the notes for all the things. You need not to worry for that. You will get the notes. Uh, you will get the notes before the end of the complete course. You will get complete notes. Any other question that anybody want to ask or any clarification? You can contact. You can directly mail your questions also in future as well. If you have any question related to toxicology, my mail ID I am sharing you with in the inbox pr.jitendra k2 at the rate gmail.com. So in when you are learning, you can even personally ask after the course event any questions related to toxicology. So I suppose I must end my session, this live session. Uh, Although very limited participants join. Thank you so much for your joining. Mitali, Rachna, Prerna, Veera, and all those who are attending. And after the live session, it will be recorded and it will be available. So those who are listening, thank you so much for your participation and best wishes for the course and best wishes for your exam. Thank you so much. Thank you.